Hey everyone. So recently I got a question that was, how did you transition from working within a normal rehab setting to working on focusing on sexuality and intimacy and making this your whole career? So I thought I would give some explanation of how I did that. And so what I'll first do is what I did was I started in acute care. It was acute care that also had like an acute rehab wing to it. So I really did both. And then I moved into I built a sexuality and intimacy outpatient clinic, and then I transitioned to private practice. So we'll go like acute care clinic to private practice. So the transition from acute care or regular old OT to building a program and having a clinic at the hospital that I was working at. Number one, first and foremost, is I built my competency. So I took a lot of training, in order to be an ASEC certified sexuality counselor. And then, of course, as you all know, I've developed a lot of training myself with the Institute for Sex, Intimacy, and Occupational Therapy. So I did a lot of training, and then I also did a lot of training development, which also helped me build my skills. And then I worked with patients. So I worked with clients, like practice, chipping away at that comfort level and that like applying what I was learning to the clinical practice. So that's really the most important thing, right? And then the second thing I think that is really important is that I just talked to everyone possible about sex. Obviously, I talked to my clients. That's what I just talked about. But then I talked to my coworkers, my supervisors, my leadership, and then other departments at the hospital. So I really became known as the point of contact. So by talking to my coworkers, what I helped do there, and that some of that was like in services with my coworkers. What I helped do there was that I was educating them on how to talk to their clients about sex, educating them that it was important, but then also educating them that I could be their resource and that they didn't have to do all of it and that they could then send that client to me. And so now I'm sort of like building the clients that I'm working with. And then I would do like talking to my supervisors and my leadership was all about saying like, hey, this is, showing them the research that this is important for our clients and that occupational therapists are really like hesitant to address this. But also really honing in on like why that matters. So a practice gap is a practice gap until people understand the impact of that practice gap. So we have to really hone in on the fact it's less important like, hey, there's a gap, and it's more important what the impact of that gap is. So one would be like saying what would be the benefit, like better quality of life. People would feel more satisfied with their sexual experiences. They would learn self-advocacy. They would learn self-esteem. Kind of like holistically talking about what are the benefits when this particular occupation enhances, what are the benefits overall to all of our other meaningful life roles. And then also talk about the gravity of it, right? Talk about the outcomes that we want to try to avoid. I'm just going to name a few. Depression, anxiety, divorce, assault, perhaps unplanned pregnancy or transmission of STIs. So you're really trying to hone in on like, help them understand the benefit, but then also the impact of that practice gap and what is the detriment to our clients when we're not addressing it. So that's really what's really important for leadership, because they can see that that you offer the solution, right? So we're presenting the problem and saying that we're the solution. And what's really important to them is that it can be lucrative, that they can bill for it. So kind of as I continue to talk, like pay attention to how much I brought business in by talking to my coworkers, Of course, talking to the clients that I have. But then another thing that I did was I would go out to other departments. And I worked at a major medical facility. So I would go and do in-services at like rheumatology or urology or neurology, behavioral health. So I would form these relationships. And sometimes it just started, if I wasn't always like approved, to spend my time doing this, I mean, I always did it on my lunch break. But maybe I would just like meet someone in that department for coffee or for lunch and tell them about, what I'm doing, and maybe see if that request can come from top down, right? So seeing like when a neurologist contacts your leadership and says, from top down that they want someone to be able to send their patients to that can address this, that's huge. So that's not always you drumming up that business. Sometimes it's getting people to ask for it. And so that was very helpful. So ultimately, I started to make a name for myself, and my OT coworkers would ask me to talk to their clients, and people would ask me, and it was unofficial at first, right? Like it wasn't this like formal referral process, but once you get enough, then you have to say like, we need to make a formal referral process around this. And so that gets the leadership's attention. So really, you're chipping away at it. I want to say this. From the start of acute care to having my own, having a sex and intimacy clinic, that was 5 years. And from having a sex and intimacy clinic to now working for myself in private practice, that was another 5 years. So it's a lot of chipping away, and its progress is incremental, and it's tiny steps, and those steps are really, really important. And I will also say too, like I didn't get approved for like everything that I did because it was within my scope of practice. And so I think oftentimes I know that we can think that because nobody is doing it, we think that we need permission to do it, or we think that maybe we're not allowed. But really no one is doing it because everyone's uncomfortable with it. And so if we can provide the solution, then that's fabulous. But I know people that have said like, how do I know I'm allowed to even just talk to my like acute care patients about sex and intimacy? And my response is, you're allowed. Like that's a part of their care. You can make goals on that, and you can address that with those clients, and that's really like how you get started. Now transitioning from having this clinic where I was a full-time provider in that clinic to transitioning to private practice, logistically, the logistics of that are I had, you'll find an electronic health record management system. You'll figure out where, now that you're self-employed, like you'll figure out where you'll get your health insurance from. Managing your business expenses, getting a virtual bookkeeper, doing your taxes properly, thinking about like financially how you're going to support yourself as you build your business. So think of it as like build, grow, and scale. So, I'm building my private practice. And so how am I, thinking like how in the interim am I going to support myself with that? And then also like another thing that's so obvious is having a way for potential clients to find you. So having a website, having yourself listed on directories. I'm on Psychology Today in my area. And then of course, I have an Instagram account with the Institute for Sex, Intimacy, and Occupational Therapy, and that's for occupational therapy clinicians. So I developed another Instagram account for potential clients that would want to come and see me. And so this is how people need to be able to find you before they either self-refer. Now that's for self-referring. For what's really, really important is building those relationships that I was kind of talking about, like with clinicians or other providers at the hospital that I was working at in other departments, urology, gynecology, neurology, all of those places. And forming those relationships in my own community. So reaching out to healthcare professionals in my community, again, pelvic floor physical therapists, behavioral health, social workers, again, urologists, gynecologists, neurologists, and building relationships with them. And how do you do that, right? When they have no idea who you are, and you're not an employee at their hospital. So it's just, sending emails, finding contacts, sending emails. Like, think about it like trying to make friends. Networking is about relationships, and that's, if you can approach it and saying like, I'm trying to make friends, present a solution and also help them out, then that's the way that you network. So it's a lot of like asking people to jump on Zoom calls, inviting them to lunch, bringing them coffee. And so it is very similar to how I developed the clinic at the hospital that I was at. It's a lot of those same strategies that are making me successful in my clinical practice. So that's it in a nutshell. Of course, there's like tons more there, but that's, I think, good to get y'all started thinking, like processing and like how this could look for you. I don't think, this question came from a bunch of students, which is awesome. And I don't think that it's ever too early to start thinking about these things. It's never too early to say like, this is what I want to do with my career. And then now, like, every step is like, you're educating people. When you go to that job interview, you say, this is something that I can offer this clinic. When you're thinking about, if you're not in OT school yet, like, you're thinking about what program is going to address this, or and that, I think, can be really helpful. So it's never too early to start sharing, what your passions are, and doing training and doing education. And so I'm really excited for anyone that wants to do this work. I always think, we're trailblazers, because it is a practice gap. And it's a thing that a lot of people want to shy away from. And you do need to have some amount of kind of like a little bit of rebel in you to do something different. I don't think that it's so funny, right? Because like, sex is not different, and it's not an emerging practice. It's not non-traditional occupational therapy. As humans, we have been having sex forever. This has been an occupation. Ourselves as sexual beings has been important to us since the beginning of time, womb to tomb. So it's nothing new. And it's, I think of it as actually like getting back to the basics. And this is true OT at its finest. But because we're doing that, like I said, there is an element of trailblazing there. So I appreciate that, and I commend you for it. And I really, and thanks for doing that, because we need it. So let me know if you have any other questions, and I'd be happy to jump on and answer. Bye.